Very good morning, children. My topic is fluid control and soft tissue management. Fluid control is very much essential for an FPD preparation. As an introduction, I can tell you, fluid control is and the appropriate displacement of the gingiva are essential in tooth preparation to obtain an accurate impression for the cementation. So they enhance, first of all, the visibility of the operator. Second, they increase the patient's comfort. Third, they aid in the cementation, likewise impression procedures, likewise in cementation type. You know that if you don't take up an impression properly, or else if there are a lot of fluids, then your impression can get distorted. So this chapter will be telling you how to control this fluid, likewise how to displace gingiva when you do a proper FPD preparation. So let us come to fluid control's objectives. The main objective is to remove the fluid and isolate the tissue to enhance operators' visibility and to patients' comfort during this procedure. Then, while you do it, this itself, it will prevent injuries to the patient with your aerator. Likewise, the other instruments which you use in the oral cavity. Then these are to isolate and ensure dry operating field for the impression and cementation procedures. The methods what we use is cotton rolls, rubber dams, high vacuum suction, saliva ejectors. That is, a high vacuum suction can be used like the saliva ejectors or the low vacuum suction ones, and sieve doctors, anti-silobox. So let us discuss one by one. The cotton rolls, these are the most commonly used method. So in maxilla, what you can do is you can pick up a cotton roll and place it near the opening of the parotid duct. So this is available either as your conventional cotton pieces, or else you can get it in the shapes of a roll itself. So here both in mandible means in both the sides, buccal side, likewise the lingual side, you are supposed to place the cotton roll, and this will help in sucking of the saliva, or else the absorption of the saliva from the minor and the major salivary glands. And likewise, when you place a cotton roll, at the same time you can use a suction also along with it. The suctions can be low suction will do, and low suction will be very helpful to work along with. See, the low sections are the suction tip which are smaller in size. These are disposable tips with a metal rod inside. So the advantage of having the metal rod inside this type of tube is that the tube makes it very flexible. If you fold the tube, or else if you bend the tube to a particular shape, that shape can be retained because of the presence of this metal tube. And this can be used without the help of an assistant also. If you bend it and place it near the side of the patient, I mean on the cheek side, it will be remaining there without the help of the patient. Then the second alternative is to use a high vacuum suction. This is a very powerful instrument. See, this is our suction motor, where you can see that on top of it you are having a high vacuum suction with a and the low vacuum suction. The major difference is that the shape of the suction head. Here you can see it is a very small narrow tube, and this one you can see a broad and a flat surface. So what is this? This is a newly introduced mouth mirrors with suction holes in it. So you can use it for cheek retraction. You can use it for seeing your work. Likewise, it will also aid in sucking away of the water. See, in this picture, you can see the low section is placed in one side and the high section is used to retract. Likewise, it is helping to take away the fluid also. So it's a powerful instrument and compared to our conventional low vacuum section. The third instrument is known as sieve doctors. Sieve doctors is an instrument which has got a tongue retractor, likewise a saliva intake region also. See here, the saliva is taken inside and this part is connected to the low vacuum section. See how it is being placed inside the mouth. Here, this is the tongue and this is the tongue retractor. Likewise, the other the head will be inside the lingual space area. So the advantage is that when you do a preparation, or else if you want to place a cord, a retraction cord, everything, you need a dry field. For doing that, your tongue can be replaced and pushed away, or else you can retract it with the help of the sieve doctor without the help of an assistant. So it is a flange type of saliva ejector made up of metal used for fluid removal and tongue retraction, but can be used without with patient positioning the patient in an upright position. And the most advantage is when you use a sieve dropper, you don't need the assistance to help you. And but the major disadvantage is if you have a limited mandibular space, or else if there is a tori is present, then the usage of the sieve doctors is difficult. And it can also cause for the injuries to our floor of the mouth. The other method is to use anti-silogogues or else the chemical methods. So as an anti-silogogue, many drugs are being used. One is anticholinergic drugs like atropine, diclomine, propanthaline, and they are given 1 hour prior to the procedure. These are contraindicated in the cases of glaucoma patient, asthma patient, obstructive conditions of the GIT, congestive cardiac failure, etc. Polinidine is an antihypertensive drug. These are a little more safer when compared to our anticholinergic drugs. And the colinidine's problem is they might cause the drowsiness to the patient. And other is the use of local anesthesia, which blocks the impulses from the periodontal ligament and regulates the salivary flow. So coming to the dosages, the atropine sulfate is around 0.4 milligrams. Diclomine is approximately given 10 to 20 milligrams. Propanthaline bromide is given around 0.75 to 15 milligram. Colidine is given around 0.2 milligrams. And coming to the gingival displacement. Now the fluid control methods are over. Let us see how the gingiva is being reflected. The major advantage of reflecting the gingiva is to have a proper idea or else the proper reproduction of the finish line in our impressions, likewise on the cast. So to provide to accurately duplicate the subgingival margins, to provide best possible condition of impression materials and the fluid control, to fabricate accurate restorations, thereby preventing the periodontal problems. You know that the margin of a tooth preparation is the most important and factor which decides the marginal fit of the crown and its and the finish lines This gives the lab technician where to end his the prosthesis. So this has to be duplicated very uh, uh, very at the most important care. So coming to the objectives. So objectives means a proper finish line has to be exposed. Then the the GCF has to be controlled. Then the depth and uniformity of the finish line is seen very much with the help of gingival retraction methods, and allow refinement of the finish line without laceration of the soft tissue, uh, and they provide an access of the impression material to record the finish lines very clearly. And this helps to obtain an accurate marginal fit while reducing in the marginal leakage and subsequent debris of the tooth. So let us see what are the different methods of gingival retraction. Gingival retraction is basically done in four methods. One is mechanical, chemical, and surgical. So what is mechanical methods? Mechanical methods means you use a rubber dam, cotton thread, copper band, and a magic foam cord. Then is the mechanical chemical method. That is, we use a mechanical system as a retraction cord, and we will be dipping these retraction cord in some chemicals to produce to reduce the bleeding and give an anesthetic effect. So that makes it mechanical chemical. And the third one isn't purely chemical. Chemical, the use of expaseals. And the fourth method is the surgical procedure. Surgical procedure, what that is done is rotary curettage, electrosurgery, and the use of lasers. So coming to the mechanical procedures in detail, rubber dam is being used, or else the cotton thread, the conventional method, and previously they used a copper band, and the latest ones are the magic foam cord. So let us see one by one in detail. First is the copper band. So copper band is a cylindrical tube which is placed above the tooth. Inside the copper band, they have plugged in either a silicone material or an impression material inside this tube, so which can be pushed onto the to the prepared tooth, and a dental floss is tied inside a vent between the on the upper side of the copper band. So this inside this with the help of this, we are able to pull it out. The dental force can be help in pulling the copper band out after getting fixed onto the tooth, or else after getting it set. Let's see in detail. So as I said, this copper band is placed on the prepared tooth like this. So this here in this picture, you can see that this helps in displacing of the gingiva. Now let's see how the marginal gingiva is being displaced. Here, the impression material displaces the gingiva, and this impression compound or an elastomeric material is used in this inside this copper tube. Then it may be that after making this, what is done is you will be using a dual impression to pull it out. Indicated, and this can be indicated with the multiple abutments also. Since it causes injury to the gingiva, and the amount of retraction what we receive if, from the impression compound is being less. This method is not being followed nowadays. So, and one of the end of, see what happens over here, one end of the copper band is trimmed to follow the gingival margins, and the top part of the gingiva is plugged with the resin or the impression compound. A vent is placed along with the escape of excess impression material. Dental floss is tied through the vent to facilitate an easy band removal. The tube is filled with impression material and is placed parallel to the tooth such that the trimmed margin coincides with the free gingival margin and displaces them. But because of its drawbacks, it is not being used right nowadays. Then the latest method is to use of a rubber dams. When used, limited number of teeth are being restored at once in a quadrant, and when prepared, they does not extend subgingivally, and it must be seen that the additional silicons must be avoided as while making an impression, as these additional silicons interfere with the nature of the rubber dams. Then the cotton threads. These are the conventional made things. Cotton threads or plain cotton threads have been used along the gingival margins, and this will produce a fine hemostasis while the preparation. And the last one, or else the most modern one, is a magic foam coat. This is a polyvinyl silicone material, so which is being injected into the gingival sulcus with the help of these type of mosquito tips, and this has a separate thing known as compre cap, so which are hollow tubes. It's kind of hollow cotton tubes, or else like hollow cotton cylinders. Inside this, your polyvinyl siloxane material is being injected, and this makes it. This is placed on the top of the crowns, the prepared, not crowns, prepared tooth, and the patient is made to clench on it like this. So you can see the prepared tooth. On the top of that, a cotton compre cap is placed, and the material is injected, and the patient is asked to bite the cap. So this will take at least around 5 minutes to get set, right? And after that, these caps are being removed. The caps are available in different sizes like large, medium, and small, or else they call it like one for the centrals, then for the premolars, and for molars. So, and it is, since it is made up of cotton, hemostasis is also takes place. So after that, what happens is you get a perfect impression. When you take out the compre cap, the polyvinyl siloxane comes along with the compre cap off, and retracts will have a retracted fluid-free environment for the impressions. The conventional method is the mechanico-chemical methods. In mechanical chemical methods, you can see that this green color thing is known as retraction codes, and these are packed into the sulcus. So here what happens is the retraction cord is used for mechanically separating the tissue from the prepared margin, and these cords are impregnated with chemicals, or else you can call estrogens for the action of hemostasis. And it will be left in position for a while. After the proper hemostasis is acquired, this impression, these cords are removed and an impression is being made. So, what are the ideal requirements? They should be dark in color, and it is never preferred to be red because it can confuse with the gingival tissue. And it is made up of an absorbent material. This is strong enough to resist the displacement and should not snap. And it should be available in different diameters as as 000, 00, like that. There are different 2, 3 types are there. So what are the chemicals used? The chemicals used are ferric sulfate, aluminum chloride, and epinephrine. So all these things, what they are done is they are used. These pods are placed inside these chemicals, and they are tucked inside around the tooth. So coming to the classification, they are again classified as plain and lubricated, and non-lubricated. Likewise, these cords are twisted, knitted, and braided. So you can see in this picture what is the difference between braided cords and the knitted cords. Let's see how the technique is done. Once the cord is placed in the sulcus and the impression is made immediately with the retraction, and after that the retraction cord is removed. So this is known as the single retraction cord method, and the other method is known as the double retraction cord method. I repeat, there are two techniques. One is called as single retraction technique, and the other one is called as double retraction cord technique. On a single retraction cord, the cord is placed inside the sulcus, an impression is made. After the impression, it is immediately after the retraction is done, the cord is taken out. Then the double retraction cord, the thinner cord is packed inside deep into the sulcus and left while making the impression areas. Then a thinner cord is placed onto the above the top of the thicker cord. And before making the impression, the thinner cord is removed and the larger second cord is left inside the position and the impression is made. So single retraction cord, let us see how it is done. About 2 inches of the cord is taken. If then it is dipped inside the solution to make it moist, or else if it is not imbricated, we will dip it inside the solution. These are mostly the estrogens, what we talked before. Then we make a U-shaped loop and place it around the tooth. And a cord packer is an instrument which we use to pack it around the tooth. See, here in this picture, the retraction cord is dipped inside inside the hemostatic agent, and we are making a U-shaped loop. Then it is placed around the tooth and it is held with the help of thumb and the forefinger. See, like what is shown inside the picture. See, you can see an instrument over here. This instrument is known as the cord packer. So the cord packer will be helping to push the material from one side to the other. When you start pushing, you should start pushing from one side. That is from the mesial side surface of the tooth to the proximal surface. And while pushing, the cord packer should be angled. You can see it should be angled towards the tooth so that the cord goes underneath the surface of the tissue without hurting it. or else you can call it the cord is placed subgingivally. And the excess cord which is there can be cut off and it is left for 10 minutes. Then moist the cord with saline. After then slowly remove the cord off. If in the double retraction technique, I have told you a smaller cord and a larger cord is placed. The smaller cord is placed the first and then goes for the larger cord. Afterwards, after receiving a proper required gingival retraction, the larger cord is removed and the impression is repeated. The second, see over here, a second cord is placed over it and it is soaked in hemostatic gel, left for 10 minutes. Then the second cord is removed. The first cord is left in the sulcus while making the impression. So what the other chemical methods are known as the use of exspasels. The exspasels are materials that contain aluminum chloride paste. So this paste, as it is shown in the picture, it is injected around the tooth or else injected into the gingival surface. The paste is left in the sulcus for around 3 to 4 minutes and it is washed off from the impression surface. After having a proper hemostasis and very less of trauma, this tissue, retracted tissue, will be recorded by the use of an impression material. So the last method, that is the surgical method. Surgical methods, what we use is the rotary method, electrosurgery, and the soft tissue surgeries with the help of a laser also can be done. So the rotary curettage method was introduced in 1954 in Amsterdam. So it was something called the gingival toughening technique. The epithelial tissue in the sulcus was removed with the help of a rotary instrument and the finish line was created, or else you can call it exposed. So the technique can be used only if there is absence of bleeding, or else if the tissue is having the bleeding on probing and type of tissue is there, this method is not at all followed, and it can be used only for sulcus depth less than 3 millimeter. And the gingiva should be properly keratinized. If it is not, this method is not at all followed. A shoulder is being formed at the level of the gingival crust prior to the surgical curettage. The epithelial tissue in the sulcus is removed with the help of a torpedo diamond bar while creating the finish line. Then the gingival retraction procedure by a trough around the finish line. Around this area, you can see the gingiva is being removed off. The chances of deepening the sulcus due to poor retraction or the pure tactile sensation can happen. If it is so, then it can destruct the periodontal tissues. If periodontium is being is disrupted, then it can lead to chances of caries entry, periodontal problems, etc. So then the other method is the use of electrosurgery. These are high density current is used to cut away the tissues. The cells in contact with the electrode, this is an electrode, and this will destroy the tissues which are in contact with the use of high rapid temperature, literally burning away of the tissue. So it is used in gingival sulcus enlargement and hemostasis stasis condition. gingivectomy, and crown lengthening. In procedures, these electrosurgery instrument can be used. So it is contraindicated in patients who use pacemakers, insulin pumps, etc. And patient with a delayed wound healing due to debilitating disease or the radiotherapy, these things should be avoided. Then it should never be used in if the attached gingiva is very thin. And you should not use any metal instrument, prefer plastic instruments in the mouth and the suction tips when you use an electro-rotary machine. And it should not be used in the presence of any flammable substance such as topical anesthesia like ethyl alcohol, aerosol, nitrous oxide, analgesic materials, because the electrosurgery surgical tips can produce spark and may be a cause of flame. So this is the units picture. This is the control box, and this is the handpiece. In the handpiece, you can see that the blue color is an electrode. There are different types of electrodes that are available in different shapes, and these can be used accordingly. And this is a ground plate for electrode. Sorry. The high frequency oscillator or a radio transmitter is used. Then the handpiece holds the electrode, and the electrode is used for cutting of the small tissue of the tissues, and the ground plate is used to complete the circuit and prevents patient burns to the patient. These are the different types of tips which can be used on the patient. And so you can see this prior to the surgery, how the tissue was there. After the surgery, the sulcus is enlarged literally, and the tissue surface is being burned away. Here also the working end should be held at approximately 15 to 20 degree angle, and it is carried out through the tissue until it rests on the tooth with a wedge of tissue is being removed. In case thin gingiva electrode is angulated parallel to the tooth. It must be removed at a speed of 7 millimeters per second to prevent lateral heat penetration. And no stroke should be repeated immediately if needed. A lapse time of 5 seconds should be provided. This is to give the tissue cooling time and to reduce the overheating effect. Then high volume suction should be kept to prevent the foul odor. As you know that when something burns inside the mouth, a very much foul odor will be found, and the high vacuum suction literally sucks the foul odor, and it also keeps a cool air on top of the preparation area. So the last one is the use of a soft tissue laser. Lasers means light amplified stimulated emission of radiation. So what the lasers can be used for many procedures like surgical procedures, for soft tissue procedures. See, one is crown lengthening, one is the gingival roughening, or else you can call it the gingival retraction methods. And this, in this image, you can see this is a surgical tip, and the surgical tip, when initiated, it literally like an electrocautery, it burns away the tissue. There are different types of lasers are being used. One is a carbon dioxide laser, YAG lasers, then Nd:YAG lasers, diode lasers, argon lasers, etc. So the advantages is it produces an excellent hemostasis. The visibility is very much good. Then the holding and grasping is like with a pen style is achievable. The efficiency and effective soft tissue removal is effective. It is safe around the implant tip. And one more advantage is no need of topical anesthesia. No periodontal pack or a suture is required after the use of laser. Then, since it is the post-operative pain is very less, yes, then the advantage it reduced, the swelling is reduced. Then gingival margin and exposures, the recession in this particular areas will be reduced with the help of laser. So these are the different methods of using a gingival retraction. So coming to the conclusion, gingival displacement is an important procedure for fabricating indirect restoration, especially when subgingival finish lines are used. So it is simple and effective when dealing with a healthy gingival tissue when margins are properly placed. Thank you. So I hereby end my class of gingival retraction, and by next week we'll be returning with a new topic. Thank you.